also wait for just thank you, Rita. We'll wait for just a couple more minutes for folks to join us. And while we're doing that, I'll also introduce myself. So I wasn't able to join you all in the first session, but I'm really, really happy to be here today. I'm Rubina. I work with the online learning team at the Prevention Collaborative, so with Rita and with Manon. And yeah, absolutely thrilled to be here and get to know all of you and learn with all of you. So thank you for making time for joining us today. Maybe we can get started as folks trickle in. Manon, could we go to the next slide, please? So today's session is going to be about the what and why of prevention. We will dive deeper into it, but before we do that, we'll do a quick group check-in and see how everybody's doing and just see how we're joining the space today. So in the chat box, I would invite all of you to please share the color that you feel represents how you feel today. So any color that pops into your head when you think of what you're feeling right now and how you're feeling this morning or afternoon, wherever you are. So please feel free to pop that in the chat box. Rainbow, Hami, thank you for sharing that. Would you like to just unmute and tell us why the rainbow? All the colors today for you?
Actually, in Nepal, we're marking the OBR, One Rising event today. And one of the theme is we're discussing on the rights of the LGBT people. And I was just coming from that event, discussing it, and that color is still stuck in my mind.
Oh, excellent. Thank you so much for sharing that. Just seeing a couple of blues, couple of oranges. Glad to see that in there. Any other colors coming into mind for anybody? You can also feel free to unmute and share if you feel that's easier for you. Oh, lilac. Oh, I'm sorry to hear your neck's hurting, Maria, but glad you could still join us and be present today. So thank you so much. But hope you feel better very soon. Great, great. This is great to see, and we hope to keep having more time throughout the day today to chat with you over the next couple of hours and get to know all of you a little bit better. So thank you again for joining us. We'll now get started and hope that people keep joining us as we go along. Manon, can we have the next slide, please? So today's session, we just started with the group check-in. We will then do a little bit of housekeeping and then a quick review of last week where we share one of you, since you all had sent your take-homes, we had such a great experience going through them. But we would invite one of you to share about your take-homes and then review the key messages from the last session. Then go deeper into the crux of the session today, which is on what is prevention, why is it important, and also talking about the prevention to response continuum. Towards the second half of the session, we'll do some interactive group work and then invite you all to share your learnings from that group work with us later, and then just go over the take-home exercise for this week. Next, please, Manon. So starting with the housekeeping, we want to just request everybody, we know we come from different spaces, different data issues, technical issues, other stuff may be going on, but we do invite you to keep your video on if your connection and your situation allows it. But do mute yourself if you're not speaking, just so we can make sure there is everyone can hear us clearly and the recording is clear for those who missed the session. We also invite you to appreciate art diversity. We're so excited that there's so many people from all over the world joining us and from different communities and different cultures. So we appreciate that everyone has valuable learning and ideas to share. And we hope that we can all be open to learning from each other and respond to each other respectfully. Um, the third thing is step up and step back. This is something that we really believe in at the collaborative, and we hope to have that culture in these sessions as well. That we want to hear from everybody, but while you're speaking, also consider your own participation. Is this a space where you need to step up and make sure your voice is heard? Or is it a space for you to step back and allow space for others to be able to share their experiences? So just keeping that in mind as we're doing interactions with each other or group work or even throughout the session. We try to be mindful of that ourselves as well. So we hope that these are some things that we can all agree to for these sessions. I will pause here if there are any questions or any thoughts coming up for anybody that you'd like to share. Okay. Next slide, please, Manon. Now a bit on logistics and attendance and assignments. So please do sign in for session 2. Rita, I would request if you could share the attendance link in the chat box. So once you click through that link, it will take you to an Excel sheet. So please just mark your attendance there if you're for the session today. Rita's just put that link in the chat box, so please feel free to take a minute and go ahead and mark your attendance. The second request is that we do share a PowerPoint template for take-home assignments. That's because it's easier for us to review and for us to put together. So we do appreciate that if you can, when you're submitting your assignments, share them in the PowerPoint template, ideally not in a Word document or in an email. It just makes reviewing a bit easier for us. But in case you have any difficulties or any technical issues, please do reach out and we'll try our best to support you in this process. Next, please, Nanon. So now that we're done with housekeeping, just moving to the review of last session. So last week was session 1, our introductory session. For this review, I'd like to first, next slide, please, Manon. I'd like to first invite Alfred, who has graciously accepted to share his take home with us. We had a great time reviewing these and everyone had done such an excellent job. We learned a lot through this process. So we do really appreciate you all taking the time to do these and send these in. We have invited Alfred today because it isn't that like everybody's take home was excellent and there was no issue, like no criteria as such, but we did think that Alfred brought in some interesting points through their take home, and we'd like to invite Alfred now to please come and unmute yourself, share a bit about your take home with us and what you had put together. I would only request if you can please keep your sharing to about 3 to 5 minutes, because we do want to keep time. I know it's a little bit of less time, but we would appreciate if we can keep it under 5 minutes today, please. But over to you, Alfred.
Thank you very much, Robina, and good morning. I'm Alfred Okeng, and I'm excited to share my experience, but also my responses in line with the take-home exercise that was given to us last week. So I know that limited time, we might continue with the conversation in our learning forum, but just to dive into the question directly, question number one was asking us to share our experience in using data to inform our work. And in my case, I've been using data for the last 7 years to inform violence against children and also violence against women programming. And from using data, I noted that data has really been very helpful in helping me to determine the locations where the program should go in terms of geography, but also data use has also supported me to tailor the interventions to address the needs of a specific group of people, women, boys and girls and men, but also be able to target stakeholders at the different levels, like at the national and the subnational level. And also in my course of using data to inform my programming, I also noted a few gaps which relates to maintain, where sometimes some of the service providers do not complete the documentation tools. For example, if a survivor comes to, say, a facility and is a case management tool, you realize that not all details of the survivor is captured, like the details where they're coming from, and when and when the abuse happened and when it was reported. So it makes it a little hard for someone to really be able to, to support and to really collect data that supports in making an informed decision. I also noted that there's also lack of standard data harmonization across providers. For example, also you find that this case, a GVB case, is reported in police and also reported at the facility. But at the end of the data collection, you realize that these are treated as separate cases. So noted that it makes a little, makes data collection, but also analysis and use a little challenging if data is not data on the cases are not harmonized. I also noted standardization, where different providers are using, the different tools that suits their need. And in most cases, they're missing the national management tools that are supposed to be to be used documenting the cases. So that's basically my experience using data to inform my work. And the data sources that have been able to use, the prevalence data sources like the Uganda National Violence Surveys 2018. I also used the National Demographic Health and Health Surveys. I also used the AfriChild Uganda Survey 2020. AfriChild is a local NGO working in Uganda, and their work focuses on addressing violence against women and children. I also use administrative sources like Uganda National Helpline, where cases of violence against women and children are reported from community to the national level, where this National Child Helpline is housed. I've also been able to use the Orphans and Vulnerable Children's Management Information System, OVCMIS, to be able to, get the data that informs my work. And also the GVB shelters, the records from the GVB shelter, from facilities, and also records from police, and also district action centers. Yeah, next slide, please. So how have I been able to make use of this data? I would say that data use has been part and parcel of my work. And I've noted that without evidence in terms of data, I cannot have an informed choice or decision regarding my program, but also to advocate, use it as a tool to advocate to different stakeholders, including governments. So in the financial year or fiscal year 2020-2023, the data that I collected from Uganda National Child Helpline, the Violence Against Children Survey 2018, AfriChild, supported me to inform USAID Uganda in the selection of our districts where they would implement a prevention program. And as a result of this, 14 districts were eventually selected. And these were districts which, from the data, had high rates of teenage pregnancies, but also child marriages. So these districts were prioritized for implementing the prevention program in Uganda. Similarly, in the financial year 2020-2021, the data that I collected and analyzed from the OVCM, IMIS, GVB shelters, district action centers, also supported me to advocate to the Ministry of Gender to support in establishing GVB shelters and district action centers in some of the districts that, again, the data showed that had high prevalence of teenagers and also child marriages. And as a result of that, still 12 district action centers were, and also 6 GVB shelters were established across 18 districts in the country. And this actually district that does not overlap with other prevention programs supported by other agencies like UNICEF, Save the Children, Plan International, Action Aid International. And still again in 2015, when I was working with Plan International as a child protection specialist, we needed to support health facilities and also police to address some of the gaps that they may be facing in regards to handling violence against children and also violence against women. And in planning for this support, we needed to have a basis for this support. And in doing that, we collected data. We again collected data. I participated in collecting data from health facilities, from police, especially Department of Children and Family Unit, in regards to how they were handling the cases, managing the cases. So the data from the analysis, we noted that there were gaps in documenting the case management tools. We also noted that they also had limited skills in regard to providing client-friendly services. We also noted a problem with data analysis and also reporting. So we use this data again to train over 400 health workers and also 300 police officers in case management, documentation and reporting, but also the application of WHO Lives approach, first line approach when supporting the survivors of violence. Next slide, please. So next slide, please. Question 2.
Yes, Alfred, sorry to interrupt, but just a request if you can summarize the next couple of questions in the next 1 minute or so. We're a little bit short of time.
Okay.
Thank you so much.
So for question 2, we are basically requested to look at the data source that already provided, also any data source that we might use, and then be able to compare the data, what the data is showing with our field experience. So I used demographic and health surveys 2018 and also rapid gender assessment Uganda report 2020. And from the data that I saw or I looked at from the demographic and health survey, I noted that the physical violence is highly reported and also pervasive, and this is across the age band 20 up to 29 compared to sexual violence. And I am in agreement with the data that I saw. Why? Because in Uganda, physical violence is widespread, but also reporting is high compared to other forms. Why? Because it's easier to identify the signs like the cuts, the bruises, and so forth and so on, compared to the sexual violence. And also what the data presented also speaks to what the findings from the rapid gender assessment, which was done in 2020, which also found that physical violence was really widespread, and also most people are reporting compared to other forms of violence. And we also noted that sexual violence, specifically in Uganda, reporting is changing. Why? Because sometimes the survivor feels she will be victimized, stigmatized, and also fear of divorce from the spouse, but also sometimes also, you know, from community, they will look down upon because it's something that, you know, you're supposed, you know, issues related to sex is the man is supposed to have control. You don't have, you know, power as a woman, you know, when and how, and, you know, is always, you know, determined by man. And we also noted that even to health and other legal services is very challenging, because sometimes also, you know, the necessary data or documentation is not there, and sometimes also the witnesses don't really want to, you know, to appear in court of law because of fear of revenge, sometimes by the perpetrator. Next slide, please. Okay, I also noted a few gaps with the data. I noted that the data point is 2016, and yet, you know, things have changed since that time. And, you know, with the COVID, quite a number of violence against children and women came up. And also I noted that other forms of violence like physical, like psychosocial, emotional, and then economic violence is not, the data is not captured in the DHS. And that also affects programming if somebody, if a programmer really wants to develop an holistic strategy or program to address all forms of violence against women across the spectrum. Next slide, please. And specifically for Uganda, economic violence is really, really widespread, especially in the rural areas where women are involved in agriculture, they're involved in savings schemes. So sometimes, you know, they take part in this, and then, you know, men take over the sales of the produce, they take charge of the monies got from the savings scheme, and the woman will have no voice over, or, you know, over how the monies should be used. So the third question was requiring us to, if the information that we've seen or the data we've seen change the way we are addressing violence in our context. Specifically for my context, Uganda, this will not change. Why? Because as a programmer in the violence against women, I really need data to be able to make a decision for, you know, to inform my program. And as a professional, yes, this data would guide me to design those programs that would empower women in the prevention of violence against women, like engaging them in the savings scheme, but also leverage the savings scheme to encourage women to you know, to bring on board their husbands, so that some of the information and services around violence against women can be passed through that platform, and also some services that may be of interest to men are also provided. I would also then use this information to develop male engagement, you know, strategies that aims at, you know, creating that environment that is, you know, conducive for all boys, men, women, and girls to, you know, to enjoy the equal rights, but also to thrive. For example, working with men as champion in gender transformative programs that aims at, you know, promoting, you know, positive gender norms and denouncing the negative one. Still, I would also use this information to, you know, to empower, you know, families like with skills like positive parenting, to be able to bring children and socialize them at that initial stage, to be able also to appreciate aspects of violence, you know, but also use this information to, you know, inform my awareness or, you know, advocacy campaigns, both at different levels, you know, and specifically using SASA, which is a community mobilization, you know, approach, where community, when you flash the data for the community, they're able to say, oh, we've never known that we have these high rates of, you know, this violence against women in our community. So you're able to explore together with them to be able to, you know, come up with those community-owned solutions to addressing violence aspects. And then also, I think for holistic violence, as I conclude, for holistic violence against women prevention, data collection and reporting from different sources should be able to capture all, forms of violence against women. That would again support us as practitioners in designing those programs that go a long way in addressing all forms of violence and against women, but also, survivors and also perpetrators alike. Thank you, and over to you, Rubina.
Thank you so much, Alfred. And we also learned so much from you all sharing this with us and getting to understand the context that you're coming from. So thank you so much. And we really appreciate the time and energy you've taken for this exercise and helping us learn as well. I will now invite Rita to please take us through the next bit of the session. Thank you.
Thank you so much, Rubina, but I'm going back to thanking Alfred so much, and I'm joining colleagues who in the chat box are just saying, thank you, Alfred, thank you. This helps people to think how they can elaborate on their answers next time. That's great, and I knew people would like this, and this was a great assignment, Alfred. Thank you for taking time to work on it, and thank you for accepting to share with everyone. So we really got some good assignments, take-home exercises. We will be doing this because this, as we said, this is a co-learning space. We are not the only ones who have things to share. You coming with your experience and a lot to share. So we'll be trying to make sure that you as participants to the course also have space to share your experience and we co-learn together, right? So, yeah, Alfred, in your answers, you've summarized most of the points that we saw last time, but I'll take us through the key messages that we wanted people to keep as we move from session 1 to session 2. And it really resonates with what Alfred and others answered in their take-home exercise. So if you remember those who were present, and I guess I hope, I meant to say, I hope those who were not here last time, I hope you got time to watch the video and see what we learned together, what Benita took us through. And these are key messages which are not exhaustive, but summarize a few of the points we made in session 1. So we all noticed from session 1 that violence against women undermines women's rights, okay? And has severe physical, emotional, all sorts of consequences for women, their children, and their families. And that does not limit itself to that, the families. It goes to society, it goes to community, and these consequences don't stop. I mean, some of them go on and they keep piling, all right? So this is something that, makes us think about why do we need to fight this violence against women. So women may experience different forms of violence that we noticed it across the lifetime. And you remember that a diagram that Benita took us through, showing how violence happens even before a child is born, all right? And those types of violence can vary. And you all agreed in your responses as we were taking the session that there were different types of violence. And I noticed some of the types of violence that are different from one context to another context. And we just need to bear that in mind as we think about violence prevention. And we know that this is not a matter of one country. So globally, women are more likely to be physically or sexually violated, but mostly we saw that it's not people from outside, it's their intimate partners than any other person who surrounds them. So this is also an eye-opening, and we know how we can work together to program around that. So the levels of intimacy, the intimate partner violence vary from country to country, okay? And the data has clearly shown that. You remember the diagram that Benita showed us, okay? And something that we really wanted people to be aware of is that the difference between admin data, administrative data, and prevalence data. And thank you, Alfred, and your colleagues. You made a clear difference. For those who did not get that clear difference, please go back and think about how these types of data are different and how they can help us as we think of programming. But one thing to know is that the administrative data cannot tell us how many women are experiencing violence, okay? Because of course of all the reasons that we saw, including non-reporting cases. Okay, so those are the key messages, and you can go ahead and put in the chat if there is any other key message that you took out of that session that you would like us to consider next time, and share with your colleagues in the chat box so we keep the session interactive. All right. Okay, so as we go into session 2, I want to give just a quick overview of the course. Again, it's just a quick reminder. We did session 1 last time, and that took us through the nature of violence against women. And today, as Robina announced, we're going to look at the what and why of prevention. This is session 2 of our course. Okay. And of course, there will be other sessions. As you can see, we'll look into the prevention principles. We'll go into understanding the causes to find solutions. And we also go further to get some strategies that can help us prevent well. And then we'll think together about where we're going after this, looking ahead. Okay. All right, so quickly on the next slide, and the other slide, please. We're going to look at what are the objectives? What do we want to get out of this session today? So we have 2 main objectives. We want to understand prevention, what it is and why it is important. All right. We also want to distinguish between violence against women, prevention and response. So 2 objectives only. And at the end of this course, of this session, if we can have these objectives reached, we'll be okay. Okay. So I hope you all got a chance to watch the pre-session videos that we sent before we even started the course, and you were introduced to our character, Mercy. All right. We had different stories of Mercy, and today we're going to narrate another part of Mercy's story. This is part 3. Yeah, we look at a different problem in her community, and I would like, please, to request one of the participants, any of you, to unmute and volunteer to read the story for us, so we can, share this experience, learning experience. Any volunteer, you just unmute and read for us the story. I hope it's big enough for you to see.
Okay, so I'm in. Shall I start?
Thank you. Is that Natasha?
Yeah, this is me, Natasha.
Thank you so much, Natasha. Go ahead and read the story for us, please.
Thank you. One of the main problems in the community where Mercy lives is that people often get sick with vomiting and diarrhea. Community members find that the best way to treat this is to add salt and sugar to the water left over from boiled rice. Some people get better when they drink this special fluid, but others die. Mercy thinks that it would be better to stop people from getting sick in the first place, rather than treating them when they are already ill. One day, the scientists visit the community to test the water in the nearby river. They inform the community that there is bad bacteria in the water because human waste is getting into the river. This is the cause of the cholera that is making people ill. Mercy, her neighbor, and the whole community work together to take action. They make sure human waste is buried far from the river. Everyone who is caring for sick people washes their hands often with the hot water and soap. People sterilize water before they use it for drinking and cooking. The community advocates with the government to set up safe water supply and sanitation facilities. Within 2 weeks of the community action, the number of sick people decreases. After a new water tap and public toilet facilities have been installed, no one gets sick with cholera anymore.
Great. Thank you so much, Natasha. I think this was clear, and that's a story. We continue using that character to take us through the why we need to prevent violence. So now let's think about this story in Mercy's community, right? And ask ourselves, what did people do when they saw people feeling sick? What did people do when they saw people, getting sick? Please write in the chat box if you got something from the story that we narrated. What did they do? What action did they do when people started getting sick? Any response in the chat? If you followed Natasha's story, yes, they sterilized water for drinking before they drink it. Okay. Home remedies, yeah. And we'll see which home remedies they took. Yeah, they took action, of course, yes, Samson. And which type of action did they take? Community members took measures to ensure water is safe. Yeah, they worked out a solution. They made a beverage, and they made that beverage. So if Manon, you can click, please, colleagues, keep sending the responses. Yeah, so we saw that they started treating people, right? There was cholera. They started treating people. They added salt and sugar to water leftovers, yeah, from the boiled rice. This is an action they took. How can we call this? There was a problem, and they tried to do what? To respond to a problem. Great, community member responded. I like that, Cipriano. Yes, they responded, okay? This is response, okay? Now, again, another question, what did they do to reduce the risk of what did they do to address the causes? Because they had identified the cause, the possible cause of that disease, which is cholera. What did they concretely do to reduce the risk? I can see that there were some answers already. They were washing hands, they were sterilizing water. Any other thing they did? Yes, they demanded for water supplies, all right? And this actually, the next thing, this is what they did in order to prevent something else like that to happen, all right? So they actually were addressing the cause. If you can click Manon so we can see what they did. All right. So they addressed the cause. They made sure human waste were buried far from the river. They really took action. Okay. And we had that. They all tried to find a solution. They find a way to treat people who fell sick. And they got some better. I mean, some of the people got better in their community. But this was a response. However, as you were putting in the chat, beyond that, in the story, they're showing all these other things they did. They wanted to stop people from getting sick before it even happened, all right? So Mercy actually was wondering, like it is said in the story, she was wondering how to prevent the sickness. Okay, we all know that when there is a sickness, we treat it, but sometimes we wonder, how can we even stop it from happening? Okay, so actually, when they learned more about this sickness, they were aware, they were able to understand what was the cause of that sickness. The whole community came up with those solutions, possible solutions. They found a way to avoid or to prevent anyone from getting sick. And this is what we call here prevention. All right, they did prevent. Now, I would like us to pause a little bit and bring this story back to violence against women. Okay, let's think about this in terms of violence against women, either in Mercy's community. If you go to the next slide, Manon, so people see. Let's please, let's think about this in terms of VOW, and think about what we saw in the last session. Can you mute yourself, please, Christopher? Can someone mute Christopher? And let's think about this and know why do we, in the first place, need to do prevention? Okay, so you remember last time we talked about the data, and we knew we were getting ready to know why do we need prevention. So I want to know from you, why is prevention, if you believe it is important, why is prevention important? Think about this story we just heard from Mercy, put it back in a context of violence against women, and think about why is prevention important? What do you think is important? Please share in the chat box. Yeah, great, Natasha. Prevention should be the first step towards responding and reducing risk. I like that, reducing risk. Prevention is important because it makes people aware. I like your answer, Samson. Prevention is important because it allows possibility of safe and healthy space. Great answers in the chat box. Afraid to avoid negative consequences. Great. Yeah, it work on preventing, so we don't get to violence. Yes, very good answers in the chat. It is long-term solution. I like that. Great. So keep sending those reflections in the chat, and people, I invite you to read the chat. We cannot read all the responses, but I like the way people are responding, and we are on the same page, really. So we talked about evidence, you remember last time? So now here, if we even think about Mercy's story, evidence shows that it shows it clearly. And if we all agree here from the chart and from what we saw last time and what we heard from Mercy's story, there is high prevalence rate of negative consequences and negative consequences of war. We know that violence across the world is really high, and data has shown us that. So if we know that there is that high prevalence, there are rates and negative consequences that are linked to that, there is, of course, need from us as practitioners, as researchers, as people who are activists, to prevent and respond to all forms of violence against women globally, as we saw that they are at highest risk, okay? So it is clear that we need both prevention and response, and we know that they are important. But we need to note here that the objectives of those doing prevention and those doing response, as well as the types of interventions that we choose to do, differ depending on what we're doing. Thank you, Marjorie, and everyone who's putting answers in the chat. Okay, so we know that response services are critical, but I want to draw our attention here that we cannot reduce today's high levels of violence. Sorry, people, would like you to stay muted if you're not speaking. Keep monitoring the mic so we all in the same room here. So I was just saying that response services are critical. We all know that, okay? But we cannot reduce the high levels of violence that we saw from the data and what we know in our context as we support one survivor at a time. So there is a high level of violence, and we cannot just say we'll reduce it and we'll stop violence by responding to one individual at a time or one case at a time, okay? If we really want to have an impact on reducing violence, which I believe we all agree with, we need an impact, we need to stop it before it starts. And where violence has previously occurred, because sometimes it does, it happens, we need to reduce the frequency and the severity of that violence and possibly avoid further episodes of the violence, okay? And this is called violence prevention. This is something we really value. We need people to understand, and we totally in agreement with this at the Prevention Collaborative. We need to stop violence before it starts, and where it has started, if we can do anything that is possible to make sure that it does not escalate and we avoid other episodes or the severity of the consequence, that is violence prevention. And we believe we need to do that if we need to face the high rates and the magnitudes of violence that we see across the world. Okay? So now we know that there is violence, okay? We need to prevent it. Let's now look into the categories of prevention. What types of prevention can we do? All right, that will be our next round of slides. Okay, so there are different ways of categorizing prevention and response. So I want us to discuss, let's share. You people have experience, wealth of experience. So let's just discuss and hear from everyone which categories, let me put it this way, which categories of prevention are you aware of? Please write in the chat and tell us which categories of prevention you're aware of, you've heard of, you've come across, anything. What is it? Put it in the chat, tell us. Name it, and let's see if we've got the same, terminology. What are the different categories of prevention that you know of? I'm checking the chat. Creating awareness. Thank you, Kajuju. Yeah, Cipriano, primary and tertiary prevention. Thank you so much. Risk mitigation, Marjorie, thank you. Minimizing the risk. Primary, secondary prevention. Thank you so much, Alfred. This is exactly what we wanted to go in our next slides. Yes, advocacy as well as part of, we'll see where we can put it on those different types of prevention. Great. So keep sending the reflections in the chat. And as we go into the next slide, Manon, I want to show a category, some categorization that comes from the health sector. Manon, if you can click. So from the public sector, approaches have generally been categorized as primary, secondary, or tertiary prevention. And the latter is also referred to as response. So these terms, if you look at those, these terms are kind of referring to the time where the intervention happens. It could be either before, it could be during, or after the violence has occurred, all right? I saw that you put it in the chat, you're all familiar with these types of categories. So if you read, as you see it on the slide, if you read, you can see that this category, it's really time bound. It's like it relates to the time of the occurrence of the violence, the initiative to prevent violence. So, and primary prevention, as you can see, is done before it aims to stop violence before it starts. So it does not have to be whether violence occurred or not, you just prevent it from happening before it even happens. All right. And we go into the secondary prevention. For this secondary prevention, we say that it aims to detect violence early and prevent the recurrence of violence. You see, there is violence, but it is just started. Let's say it just started. It's just at the beginning, and you detect it early enough, and you try to prevent it from reoccurring. You prevent other incidences of that same violence. All right, so that is a classification. And there is also the tertiary prevention that many of you already mentioned. And this, as we defined it here, works to meet the immediate needs of the survivor, to limit the impact of violence. Yes, violence occurs, but we still call it prevention because it limits the extra, if I can say so, the big or wider impact of that violence to that survivor of violence. All right. So it works to meet that immediate needs of the survivor. So I think as we bring this to our daily lives, as people work in the field or people who live in communities where violence happens, we can already see these three types, these categories of violence prevention, right? And please note that these are related to the time of the intervention, before violence happens, when violence has just started happening, and when the violence, I mean, where violence we suspect it's the secondary, where we detect it before it really, at the very early stage of it, and where it just happened, but we intervene immediately, quickly enough to limit the impact of that violence, okay? So when we talk about prevention, most of us will think about primary prevention. This is the one that most of us know, right? And we define it as stopping violence before it starts. So when we talk about prevention, many people would say it has to be before it happened. But you who have been in this course now can already see the three categories and know that it's still prevention, but done at different timing of the intervention, okay? So this was an older classification, if I can say so, which, as I said, is from the public health sector. And it's kind of old. That's why maybe many of us are familiar to that. But on the next slide, we look at another type of categorization. Remember, we agreed violence prevention is really key. Now we're looking at the different categorization. Okay. Great. So there is this more recent, we call it more recent categorization, which is what we use mostly in our work. And I hope it resonates with many of you. And instead of thinking of time, which is before, at the beginning and after, we are rather thinking about the population, all right? That is, who is the intervention focusing on? Are we together? So we kind of shifting on basing our prevention on the time, but rather on who needs our intervention to prevent violence. Can I see some thumb up or whatever if we are still together? Please send any word in the chat. I know this is a virtual setting, but please, if I'm going too quick, stop me. If you have a reflection to share, send it in the chat. Okay, so yes, Rubina, I've noted your message. Just 1 second, colleagues. I need to attend to a take. It's just 1 second. It should be sorted out, Rubina. Thank you. So this is, as I was saying, and thank you, we are all together. Yes, Martha, yes, Samson. Yeah, so this is a recent categorization, and I want us to make that distinction. Yes, that one was also prevention, the three categories we saw, and this one is gonna focus more on the population. I don't want us to think of population as a massive, or the whole country, you know, inhabitants. No, population will mean who is the intervention focusing on. It could be 10 people, it could be 20, it could be, you know, hundreds. It distinguishes, right? This categorization distinguishes between, as you can see on the slide, it distinguishes between universal prevention programs, selective prevention programs, and response programs. Okay. Anyone familiar with this? We're talking now about universal, selective prevention, and response programs. Okay, let's look a little bit into this in details, and thank you for keeping up with me. So, talking about universal prevention programs, these are those that are directed at an entire population. Yes, I can see, Maria, this was not familiar to you. Let's go slowly through this together. The universal prevention are directed, the programs, that universal prevention programs are directed at an entire population. Remember, we talked about population as not being the entire population of a country. By population, we defined it as who the intervention is focusing on. So universal prevention programs will be directed to that entire population, community, or group, regardless, follow me, regardless of whether program participants have experienced violence or have used violence or regardless of their individual or family risk status. It's regardless of whether they are perpetrators of violence or survivors of violence, or if they are at any identified risk. So it's universal. It's universal as it is not targeting, we'll see later on if you go into the selective, it just targets an entire population, like a group of people, a group of community members, without worrying whether they have already experienced violence, they are experiencing violence, or they have not experienced violence, okay? So it is appropriate and useful for the whole community, if we talk about community, the population. Now let's look at the selective prevention. The selective prevention programs are used to work with specific groups of individuals considered to be at a higher risk. You get me? Considered to be at a higher risk. They may or may not have violence now, but in any case, you remember, we talked about data, we talked about risk a little bit, and we talk about it further. This kind of, the specific group may or may not have violence now, but are identified as being at a high risk. Okay, and we're going to work to reduce those risk factors to stop violence from recurring, stop violence from escalating. Selective, we're selecting, now we have another criteria. Oh, these people are actually at a risk. So we target that population. Remember, we talked about population as a group. Okay, so this could include, for example, families under stress, families or individuals with mental health issues and substance abuse history or problems, individuals and families already experiencing violence, where we know there is violence, okay? All right, so when we target those specific groups, we're talking about selective prevention program. We are selecting, right? Now, there is this other last but not least, and we're still talking about it as prevention, and we call it already response. Response programs, they offer services to address the short or long-term needs of survivors of violence. Okay, so now I want us to kind of think about this in a little bit deeper way. Firstly, response, we all know response is about addressing the needs of the survivors, right? But secondly, because survivors have to interact with different institutions, different people in different institutions, like police, healthcare, legal systems, we are aware of that. Therefore, the response programs, here linked to the prevention, the response programs usually work to strengthen the institutional capacities to be able to provide, so they are able to provide more accessible, more relevant, timely, and high quality services, and be responsible and accountable to women, to those survivors. I feel like pausing and ask people if this is sinking in, because we will need really to make clear those distinctions, okay? We're already talking about this as response. So why are you, Rita, if you ask me, why are you still talking about this as a prevention? Yes, we know that it has to address the needs of the survivors, but we don't ignore the fact that these survivors really interact with different people in different institutions where they need the services, to get the services. You remember, we need to stop it from escalating. So we need to be programming, so that this institutional capacity is built to provide accessible, relevant, timely, and high quality service, and to make sure that they are responsible and accountable to women. Are we okay? All right. So I want us to go, still continuing. Okay, let me pause a little bit and look at the chart. Yes, thank you, Cipriano. If it's useful, we're happy. So Deacon says, are you right to say that intervening in prevention of violence against children is selective response? So violence against women prevention and violence against children prevention, we can all talk about prevention and response as well. So depending on how you categorize your intervention, it could be a prevention or it could be a response. So don't really think about this very differently. We're talking about prevention. It could be preventing violence against women. It could also be in prevention of violence against children. It depends on, first, who you're targeting. If, for example, if I just bring it quickly to this the last categorization we talked about, if you were just preventing violence against all children in a community without considering whether they are at risk, whether their parents maybe are alcoholic or maybe, a risk to those children, there you will be doing the universal prevention, all right? But if you went and selected children whose maybe have parents who are known to be abusing some substances and who are alcoholic, which we know may constitute a risk factor to those children, then, and you target children who are in this specific category, then you'll be doing the selective prevention, right? And if you wanted to work with the service providers to make sure that those children who may have experienced that violence against children violence are taken care of in a very good way, then you'll be doing the response. That's why we say continue. You'll be doing the response, but at the same time, making sure that you are preventing it from escalating or children from getting more harm. Yeah? Is that clear for you, Dickens? If you can unmute and just say a quick yes, or if you want a follow-up to this. Okay. All right. All right. We will go into the example. Yes. Okay. Thank you, Cipriano. And Nonzwakazi will go into examples, and keep that example in mind when we go into examples. You bring that back. I like that example. Okay. So in the interest of time, let's continue looking at this categorization, and we are presenting this as a,
Yes. I think, yeah,
Go ahead, Dickens.
No, I am very comfortable with the explanation. Thank you so much. Really, depending on the nature of violence, you can intervene at 2 levels. So thank you so much.
Right.
Yeah, thank you.
Thank you so much. That's good.
I am having a challenge. I am having a challenge with my network, but I am happy. Thank you.
All right. That's good. Okay. We'll still send the recording if you don't manage to follow until the end. Thank you. So let's now continue with our prevention to response continuum. And I like the fact that we are looking at it in a continuum way. So sometimes it's really not even, easy to make the clear cuts between those categorization, because let's see that in a kind of, continuum. So here, we talked about universal, selective, and response. This is a kind of remark that we want to put. Universal and selective prevention and response initiatives complement each other. Like I said, let's see it not as one unit separate to all the others. For example, as universal prevention targets the whole of population level, we remember how we define population, including tackling social norms and structural inequalities. It is inevitably, it does reach inevitably those who are already experiencing or perpetrating violence, or who are at an increased risk. That's why when we program, it's not really easy to say, I'm going to do one piece. Sometimes we find ourselves working in that continuum that we are here establishing. So all levels of interventions across this prevention to response continuum that we are seeing, please click Manon, so we can see our continuum. Go back a bit, go back to the previous slide. Yes, all levels of intervention across this prevention to response continuum are important for a comprehensive system approach adapted to the local context. We will always talk about having the context in mind as we talk about programming, all right? For example, when prevention work is undertaken or is done in communities, it is common for those women who feel confident enough to speak out about the violence that they are experiencing and seek help. You know, some of them will be confident enough to talk. There are some who will not be able to speak and say which violence they're experiencing. So it is essential that there are accessible, quality response services that survivors can be referred to for this help. So if you start making sure that people are aware and you raise, that awareness and people now need to go find the services, you need to make sure that now that third layer of response that we call response, where you work with institutions, is also taken care of so that those people who you want now to go and demand service, who will be at risk and need some services, find it somewhere, okay? So let's see it as a continuum, and as we think about programming, think of all these aspects, and please bring it back to our local context to see what we have in place, what we don't have, and therefore know which specific intervention we need. All right, so now let's break a bit, take a short break and think as a whole group about the different examples. So I know some people have started talking about examples that they see, and we want to show a few examples. You may have your own, but a few examples that we want to be categorizing if we understood well what we just discussed, okay? So we'll be displaying a few examples on the screen, and we want you to be able to respond in the chat which type of category you feel they belong to: universal, prevention, selective, or the response that we explained, okay? So if you can have one click, Manon, on the next slide, the first click. Okay, so here we're talking about conducting an ongoing community radio program that provides information, stories, and discussions on reducing violence against women. If you think about our three categories, universal prevention, response, selective prevention, where would you classify that? Conducting an ongoing community radio. Universal prevention in the chat, yes, no, Hasna, yes. Any other response? Yeah, we have universal prevention for everyone who's responded. Okay, if you can unveil the response, that's absolutely what we saw. Click, Manon, so we can see what we said. It is universal. And yeah, it's not targeting anyone specific. It just, it doesn't matter whether violence has happened or not. It's that educational program that is there, right? So the next example, one click. All right, providing counseling services to survivors of violence. Please put in the chat which category you'll see it in. Selective for response, for Hasna, response for Dickens, for Natasha, response. Great. So I want to be dwelling a little bit on those who said it's selective. There is Alfred, there is Dickens. Can I hear from one person who said it's selective and then one person who said it's response, so we can share the discussion? So if you can unmute yourself, I'll give Fozia a chance, as we heard from Alfred. Fozia, if you're able to unmute yourself and tell us why you felt it is response, then I'll go to Dickens.
Okay, thank you. Can you hear me?
Yes, sure.
The reason why I said it's response is because, quote unquote, the act has already happened of violence, and now we are coming in to give services to the survivor.
Thank you.
Thank you.
All right, thank you so much, Fotia. Let's listen to what Dickens has to share. And please feel free, if you feel like what you had in mind earlier, you can change, but let's hear Dickens' response. Why did you think it's selective, Dickens? Okay, if you're not able to unmute yourself, can I hear from Alfred?
Yes, Rita, yes, I selected, I put selective, but also I've been thinking aloud, and I think it is actually response, but on the side of selective, actually channeled to survive to survivors of violence.
Okay,
yeah.
Great.
So it's not for everybody, but specific to the survivors of violence.
Yeah.
Thank you.
Okay, great. So I hear you, and that's great. So I'm glad we all in agreement that it is response. But please, we note that sometimes the line between the two can be really fine, and we tend to think is it response? Is it selective? Why does it target survivors? So you need to be careful. But I totally agree with you, Fozia. We are giving, a service to someone who suffered violence already. Okay, I note a question here from Sanjong, and I want to just give a quick response to this before we proceed. So they're asking, can universal prevention terms as primary prevention as well? Yes, it can. The reason I say it can, if you think at the two types of categorization, don't really think that it's a big deal. So, I mean, what we need to know is to know that for primary prevention, primary, secondary, and tertiary, we're basing our categorization on the time, right? And that primary means before it happens, okay? So, of course, if we talk about universal prevention, it can, because we don't worry, we don't care about violence having happened or not. We just throwing a program out there. All right. So it could be primary prevention if that entire population, the people we are targeting, they have not experienced the violence that we want to prevent. Okay. So I'm not preventing you from thinking about the two categorization in parallel, but let's not really take our mind away from the focus. We know that the one that is quite old, that has been used for years, is just focusing on the time where the intervention happens. And this one is focusing rather on the population. Who are we targeting? Okay, does that provide an answer to your question, Sanjong? You let us know in the chat, or you can even have a follow-up. Yeah?
Yeah, thank you.
Okay. Great. So let's continue with the third question or example quickly. All right, this one, conducting a group discussion with men who have a history of perpetrating intimate partner violence to help them reflect on the causes of violence and learn how to prevent it from happening again. Okay, I can see a good number of selective. Glad. We are all in agreement, so we won't dwell too much on that one. Please, one more click, Manon, and then we go on the following slide very quickly. Okay, so everyone said selective, and it's clear, I think. We are targeting a specific group of people. Okay, so the next example, if you click one more click, Manon. All right, reviewing government gender-based violence crisis center protocols to help improve delivery of services. Please put in the chat where you would put it in the continuum. Response for Natasha. Okay, response from Sanjong, response from Kajuju, great. I like this. This is clear, so it means we all in agreement with how we categorize these. All right, so next click, so we can see the last, the response, and then another click, Manon, 2 clicks in a row. Yeah, that was response, as we all agreed. And then the last example we have here, conducting a school-based program with all adolescents in 9th grade on healthy relationship. Please put in the chat what you think this is as a prevention program. Okay, is this a new response? Please put in the chat. Can be selective prevention and response to, universal for Natasha. Any other response? Universal for Sanjong, Zineb, universal, great. I like this. So for this, we have 2 different reflections, and I can, Tabile, did you say this was selective? I would like you to say why you think it's selective, and then I give room to Andrang, not Andrang, because Andrang also said it's selective. So if Tabile, you can unmute and say why you think it was selective, and then we can discuss with the whole group. Okay, is Tabile not able to unmute? All right, can you tell us why you think it was universal, Zinab?
Yeah, I think it is universal because the program is targeting adolescents. There is no specific targets that they are addressing, but the adolescent. And the program is meant for the adolescent. It's general, not for specific target group.
Very good. Very good. So I like the explanation. Please always remember that we're talking about preventing violence, all right? So for those, I think, who said selective, they based their thinking on the why 9th grade. But we're talking about all adolescents in 9th grade, whether or not they've been experiencing violence, okay? We did not select specific adolescent girls with a certain issue that is already noticed, okay? So for Marjorie, who says, oh, okay, yes, I guess it's in a kind of, it's we are thinking about it as universal because it is an entire population. Remember, I talked about population as a specific group we are targeting. So here we just targeted the 9th grade adolescent girls as a population.
Yeah.
Okay.
Hi, that's why I had put both, because I thought of the 9th grade, but I think I understand now.
That's great. So yeah, that one we put it on purpose because we knew sometimes if with this categorization, we need to keep in mind that we're talking about violence, right? They may be 9th grade, but not all of them were in the same case of, experiencing of perpetrating violence. All right, so I'm just being cautious of time, right? Yes. All right, it was not girls with specific history of violence. Okay, I guess we are in agreement here. So in the interest of time, because we also need to go in a groups and just talk about what we do in our daily lives as programmers, let's go to the next slide. Now, we talked about prevention and we understood why it is important to do prevention. Manon, can you click? Now, we want just a little bit think about how we can make prevention effective, all right? So we talked about prevention and what prevention is and what response is, but we want to say a few words, just a few words here about making the prevention work effective. So what we know and what evidence has shown us and what we believe at the Prevention Collaborative is that effective prevention programs, either universal or selective, make big changes. They transform attitudes, norms, behavior, and structural factors that allow violence to continue. So to do this, programs must have a number of characteristics. And these characteristics, we've just picked a few here, include being transformative, being interactive, being aspirational, and having sufficient intensity and exposure. So these are the characteristics that I won't go into details for now, but I just want to tell you that you are lucky. We have a 9-week course called How to Succeed at Violence Against Women Prevention, where we can learn about each of these characteristics of a good programming. So we can go into the details of those. So because all of these are unpacked in that course, this will be another course separate. So I just wanted to give you a taste of, if you want to do programs that are effective, we need these programs to be looking or making sure that they are transformative, they are interactive, aspirational, have enough exposure. And we will be looking at that with those who may attend our other course. So I will pause and give you, I mean, I know we weren't answering questions as we went, but if there is any other question that you have before we send you into your groups to discuss further this, please ask the question, feel free to unmute and ask the question. Thank you so much. Or else, if everything is clear and you think we've covered the few topics clearly, so let us know so we can, I know my colleagues are already working on putting you into your groups so we can have time to discuss. Any question? Put a reaction. Maybe if you're good, you give a thumb up, or you say you're good to go into the chat. And then we can quickly take you through. Okay, no question from Cyprian. Okay, great. So it's clear. Thank you. Okay, good. All right, Alfred. Is that a question, or you just wanted to say it's okay? Do you have a question? Was it a reflection? Or you good to go? All right, so I will take this as it's okay and clear, and now hand over to Rubina to just tell us what we're going to do into our breakout group. As we said, we need to learn from each other's experience. Over to you, Rubina, and thank you, everyone.
Thank you. Thank you so much, Rita, and thank you so much, everybody. This has been a very informative discussion, and loving the interaction in the chat box. We learn a lot through that as well. So thank you so much. Now we just want to take some time to learn from each other in smaller groups and be able to share our experiences and see how what Rita shared applies to our context. For the breakout group work, we'll dive into two things. Menon, next slide, please. For the first 5 or so minutes of the breakout group, we can go to the next one, please, Menon. I think we're good with this. So for the first 5 minutes or so, we'd request you to take just some time by yourself, reflect on the work that you do, and list down some of the different violence against women programs or activities that you are either involved in yourself or you are familiar with, you've seen it happen around you or you're aware of. So just list down some of those activities that involve looking at violence against women. Then after 5 minutes, after everybody in the group has had their chance to reflect and note down at least a couple of activities, we invite you to come together in the group and then share those activities with each other, and then try and place them in what you feel is the correct place in the continuum. So whether it's universal, whether it's selective, or whether it's response. So try and figure out where it fits in the continuum, similar to the exercise we just did in the bigger group, and then describe why you placed it in universal or selective or response, and then invite others in the group to look at, do you agree with this placement, why or why not? And if you want to switch it, if you feel after discussion that maybe it fits somewhere else in the continuum, go ahead and move it there. We do invite you to take at least, look at least one activity, if not more, because there will be limited time, so as much as you can in that time. And just reiterating what Rita's put in the chat box, so please make sure you have a note taker, someone who's taking notes on the group work slides, and someone who's also signed for reporting back. So do make sure that within your groups that those roles are assigned. But we'll give you about 15 minutes. We are a bit tight on time, so we can take about 15 minutes in the group to have these discussions and then leave enough time for you all to come back and share it with the larger group, how your discussion went, and if there was anything that could be of interest for everybody else to also chime in for. So any questions? Any questions before we start the breakout groups? Okay, so Rita and I will keep popping in through the groups and also be around for any questions that might come up later. Rita shared the group work slide link in the chat box, so please do open that up and find your group number and start taking notes there as you get started. 15 minutes for everybody to have that discussion. Rita, I think we're good. Can we open the breakout groups? We've got a yes on access to the document. So
yes, I think we can open the groups, but I don't think we have really a big number. I think 4 groups will do.
hi, welcome back, everybody. We'll just give others a minute to join back. And I hope everyone's had an interesting discussion in their groups and had a chance to talk to each other, get to know each other a bit as well, and learn about all the different places we're coming from. So that's, I think, for me, the most exciting part. Okay, I think we have most people back. Yep, everybody's back now. I would like to now request, we'll take the next 10 minutes or so to just invite you to share what happened in your group and maybe share one example out of the couple that you may have discussed and where that fit into the continuum. So I do request you to take maybe just a couple of minutes, not more than 2 or 3 minutes at most, so that we have enough time for all the groups to share and also time for us to wrap up at the end. So group 1, who's going to share from your group just a summary of the discussion and maybe going into one or 2 examples at most. Any volunteers from group 1? Karen, Maria, Alfred, Suman, and Kajuju.
Okay.
Sorry, Cipriano, I wasn't able to hear you clearly. Could you repeat that, please?
Yeah, we could not, I was saying that we could not manage to finish up our discussion completely, but it was almost, so I think our friend Lan Murki can facilitate, he was facilitating the right notes, with the note. I think he can present the result of our discussion. Thank you.
Sure, we understand. Yeah, it's not enough time very often, but you were in which group, Cipriano? Is that what number?
I was in group 1.
In group 1, okay. So who would be sharing from group 1? You can just give us a quick overview. Maria, go ahead, please.
Yeah, I mean, can everyone hear me?
Yes.
Okay. Yeah, we just had a lot of audio issues. So I just want to thank the person who actually wrote this and put this together, because I didn't contribute, but I'll read out.
Sure.
For universal prevention, we presented examples of social media and other platforms at national levels. So, social media, campaigning, etc. For selective prevention, we presented examples of programs targeted at boys and men. We also talked about disability inclusion, and we also talked about getting the religious community involved in having them work with us to prevent violence against women. And examples in the response section. Examples like establishing a rescue center, a women help desk at police stations in Kenya, for example, was one example. A one-stop crisis center in a hospital for the health sector was another example. And then another example that I placed, but I personally continue to have problems understanding, is, for example, a hotline, a gender-based violence hotline. For me, I feel like it's between universal and response, because it supports women who are victims, but it also can support prevention, and it also can be used as a case referral center. So that's where I get a little bit confused, but I'll stop talking now.
Thank you so much for sharing that, Maria, and for putting that discussion on the slides from group 1. I think, we do agree with what you've put in universal and response. With selective, I think, Rita, what do you think for, let's say, something like targeting men and boys? How do you feel about that?
So yeah, thanks. And I agreed with Maria on what she said. Because the hotline, it could be universal because it's broadcasting messages, giving services, and it could be universal if taken from that angle. But also it could be, as you said, response, because it's also a channel. It's one of those institutions that are providing a certain service to people who already experience violence, right? So for that target men and boys, what, like we said, if it is selective, if it selects a specific group of either, say, men or boys who are presenting a certain risk of being perpetrators, let's say, of violence, and then if you program for that specific group, then you are being selective, right? But if you wanted to say, we know from evidence that most violence that we see in our community is perpetrated by men and boys, and you want to do a program that will change their negative masculine behaviors, let's say, into positive masculine behaviors, without worrying whether they have perpetrated or are at a risk of perpetrating or at a risk of being victims, then that will be universal. All right. Again, as we classify the second classification, let's think about who we are targeting and why we are targeting them. Is that clear? Does that answer your question, Maria, in the group?
Yes.
Okay.
Thank you so much, Maria, and thank you so much, Rita, for helping us with that one. I think now we can move to group 2 and see if there are more examples that we can talk about. Group 2 is Sushmita, Nanzwaki, Ikon, Hasna, Lily, Sanjog. Would somebody like to just quickly summarize your discussion and maybe dive into 1 or 2 examples?
Yeah, sure, I'm Shashmita. So,
go ahead.
In the universal prevention thing, we discussed that how there is a community level awareness, consciousness raising, and self-checking initiatives through women's collectives, and So hence, because it is like general awareness and general thing, and encouraging women to take actions or seek counseling. So that's a universal prevention thing. In the selective prevention, we had this solution model from We Men Club Juniors, like men and masculinity, and working with men and boys was the core here. So there are clubs, and then there are curriculums which learn about men and masculinity, and conversation happens among the members around gender dynamics to reduce violence. I think they also had a question here, which was around another model, which is written in the middle, like where we are saying that 68% of high school with the aim of 100%. I mean to say, this is with the high school students coming up with a photographic program to capture daily examples of positive masculinity. And then these were displayed in the community gallery, and booklet was prepared and shared with the entire community. So those who are doing are the schools, but it is at the community. So we were not sure, like, whether it's selective or universal, like, how do we, the experiences also were coming from the high schools. Namza Wakai, please add on if I'm wrong to represent here. Maybe I can just finish the response one. And then the response one, there's one of the model that we talked about was of the community-based women's court, which was a kind of reporting mechanism for the victims to come and report that they have been victimized. And then this women's court does the investigation and bring in a community level justice or community level, like, some sort of arrangement outside the court type of settlements. And then they also follow up if the woman has got the right adequate service or the right things as the court decided that this has to be the way forward. So there's a community pressure and the community court, but there's an informal acknowledgement by the police and the courts. Nanzwakazi, you want to add anything?
I think you captured it well. Thanks, Rita.
Charlotte, are you trying to? Okay, I think Charlotte's muted. Okay, thank you so much, Sushmita and Group 2 for putting this together. I do hope that the second example on selective prevention with men and boys is clear from the discussion with the last group. But I want to invite others to now respond to the question that you raised, Sushmita, about the example from the high school, that you are capturing daily examples of positive masculinity, using it in a community gallery to give examples of positive masculinity as prevention. What do others in the group feel? Like, do you think that's universal or selective? Any thoughts from anyone? Please feel free to add in the chat box. Or unmute and share. So I think it's just also reading out Rita's message from the chat on the men and boys, that engaging men would be universal, as we discussed in the example from group 1. Just reading out Sanjog's message that on the second example, the high school putting examples of positive masculinity together, that Sanjog thinks it's universal if we're not targeting men who perpetuated violence and wanted them to transform based on the group 1's example. So yeah, completely agree, Sanjog. I also think it would be universal and not selective. If we had targeted specific group of men and boys, then it would have been selective. But I think what's important to also understand with the continuum is that it is a continuum. It's not, we don't necessarily have to worry about these rigid lines with it's selective or universal. A lot of times programs will have overlaps. It can be somewhere like across as well. So it's not necessarily a very rigid structure that has to fit into one or the other, or one versus the other. So as we're making these, I think this is just to help us understand the layers of prevention, but not necessarily something to bind us. Great. Any questions or thoughts on either of these? What we've heard from group 1 or group 2? Okay. I just want to also note the time. Sorry that we are on time at the closing time for today, but I do want to request if everyone doesn't mind staying back for about 10 minutes so we can go through the examples from group 3 and 5 quickly. And Rita also has 5 minutes to share about the take-home exercise for this session. So just requesting everybody to stay back for about 10 minutes. And now requesting group 3 to please quickly share your examples. Menon, next slide, please. Completely cool if you don't have it written down. If one of you can verbally share maybe one example that you discussed, or maybe any question that you had in the group that you'd like us to discuss here. Anyone from group 3?
We could go to group 4 for the interest
Yeah.
of, then maybe they can come back if something, you know.
Sure. Group 4, please then. Menon, next slide. So Tabile, Anya, Fausia, Zainab, Natasha, if one of you can just quickly share what you discussed and if you have maybe any pressing question that came up. Anybody from group 4? Zainab, Natasha, Anya, Fauzia, Tabile?
I think from group 4, we have discussed so far the program. Those are relating in a way, like mostly engaging the men and boys. Like if you can see the universal one, like we have also added one of the part of the engaging men and accountable practices. Also the SASA program, the community radio, voices and violence mapping. And in terms of the selective prevention, engaging the faith-based leaders and CVP that was mentioned by Tabile, the choices, voices, and promise. And also, I mentioned that in particular, most of the parts we prefer to engage the men and boys, and child protection has also been added, and engaging the adolescent girls. In terms of the responses, group therapy, the psychosocial counseling, the multi-sectoral committee for the referral services, collaboration with the law enforcement agency, shelter for the survivors, and the follow-up and the action planning. Those were mentioned so far. Yeah. Anything else that you want us to let you know?
No, I think that's good. Thank you so much for sharing that, Natasha. And I hope with the example from group 1, we're all clear on engaging men and boys as universal if it's a generic group of men and boys, but if we're specifically choosing a particular section of men and boys based on either the risk or risk of violence or something like that, then that would be selective. Rita, you've got your hand up, so please do add to this.
Yeah, thanks. I just wanted to take us back to the explanations we had about this classification. So I know maybe we were not in the groups to discuss who are these faith leaders, for example, that are being selected for the program, or who are these men and boys, and what is their history with violence, either being perpetrators or being victims of violence. So I just wanted to remind ourselves that when we talked about universal prevention programs, we said they are targeting the entire population, right? Or community or group, regardless, that's what we say, regardless of whether program participants, these people we selected to be participating into the program, regardless of whether they have experienced or used violence, or, you know, if they have a certain risk that is known. So for us, it's clear. If you just wanted to talk to all the men in a community, you selected a group of men, without knowing whether they are perpetrators, whether they are a risk for people around them of being, you know, potential perpetrators. So it will be universal, unless we say these are groups of men, for example, as we said when we talked about selective, and said that in selective prevention programming, we work with specific groups or individuals considered to be at a higher risk, okay? So if you find this to be at a higher risk of either being victims of violence or perpetrators of violence, then you are selecting them with on the basis of that specific criteria, okay? So, and we gave examples. This could be people with some mental health issues, people with who are using substance that are, you know, abusing some substances that can create a risk for them, you know. So for me, we should first of all be clear. It depends on who we are targeting and why, right? So for me, engaging adolescent girls, like we gave the examples in the course today, if they are just adolescent girls, even specifically in a grade, like we said it does not make it selective. It is still universal until we've established a certain criteria why we are choosing that specific group or that population. I think it clarifies, and as we go into, you know, looking into our programs and making exercises, we can get it clearer. All right, I just wanted to add that. Thank you, Rubina.
Thank you so much, Rita, for putting that as simply as you do. It makes it very easy to understand. So thank you for that. We're at the end of the group exercise. So thank you so much, everybody, for taking the time for this. I want to request Rita to now just take us through the wrap up for today and the take home. And also just a reminder, I realize we weren't recording, unfortunately, until now, but if we can hit the record button now, we can at least record the take home. So
it is recording from my end. It is recording.
Oh, it is okay.
Yes.
Okay. Sorry about that then. Yeah.
No, that's fine.
Okay. Over, back to you. Thank you.
Right. So very quickly, and thank you for staying with us for these extra few minutes. So we want to quickly take you through the take-home exercise, which is such a straightforward one. So we have, we would like you, if you go to the next slide, Manon, so they can see it. So we have a video for you. It will be sent with our follow-up email today, and it will be accessible from the Learning Lab. And we want you to watch that video. It was done with one of our learning partners that work in Kenya, CREW. It's an organization that you will have a pleasure of discovering. And we want you to go and watch that video because we want to learn from people. These are people who are on field and do the day-to-day work, you know, with us to prevent violence. So we want you to go and find that video, watch it, and answer these 3 questions, straightforward. What were the CREW's aha moments? We believe there will be some aha moments, and if you can identify those and then put them on the slides that we'll have, we have a template. So, and then we want you to think about what is the relationship between prevention and response programming. Yeah, please think about it. We've started the conversation today. Think about it and give the answers. We also want you to think about your own programming, and you started doing this, thanks for sharing, and say how might you start to incorporate or strengthen prevention components. I like the fact one of you said it was my program, but I thought it was, you know. Now that you're starting to make the little nuances, we want you to think deeper. Either you can even talk to your colleagues, but come up with a thinking about how you can start incorporating or strengthening the prevention components if they're already in your programming. Okay. And again, if you have any problem, you don't understand any of the questions, please reach out to us here and we can clarify. So we have a template as usual. If you can scroll through the 2 Next slide, Manon. So here's how you're going to record your answers. Question 1, question 2, and then question 3. So we made it easier. I know some people have been struggling to get this template downloaded. Please, when we send, we would like you to try and download and work in the PowerPoint template as it is suggested to you. If you can, yes, Maria, we will send the template. So I guess it's you who asked the question again. So if you can stay 1 more minute, then we can hear what's the issue with accessing the template. Otherwise, once we send this assignment, it comes like at least four PowerPoints, the slides, and then download it, save it, and work on your own PowerPoint slides. And then you can, so Charlotte is asking to send a lower version. So we will see, and Manon and Rubina here can assist, and we'll make sure that we send an easy and accessible one for you. So thank you so much. And okay, yes, change the font. It's okay, Charlotte, we'll make sure that it's easier for you. We'll try to make sure that it doesn't give you any trouble. So the reason we want you to keep in the format, we will insert it, we'll give you a chance to share with others, but also we need you to remember that we have some words limitation, but we also want you to be as elaborate as you can to make sure that we have the learning out of this. Okay. So last slide, again, a reminder for the submission. Manon, click one click. So we would like you, again, you have the address where you send the take-home exercise, still the same. And please remember to mention your name and then the number of the submission, all right? Take-home exercise, Prevention Essential, Cohort 5, Session 2. And then please put your name so we can identify who it comes from. And we are here to assist if you have any issue. There is my email and Benita's, but also Rubina and Manon are here to support. Great. And the last slide is how you can stay connected with us. And stay connected with us through all these platforms. And this afternoon, we have an interesting webinar. Rubina, do you have something handy that you can put in the chat box? We have a webinar where we'll be talking about poor mental health and IPV. And if you have 1 hour to join us, there's still time for us for you to join and hear from the practitioners, hear from people who do the prevention work on field. Okay. With that said, I think we're good to go, and see you next week, and we stay in touch. Thank you so much all, and you can unmute yourself or wave a quick goodbye. And this is the Rubina has just put, there is a registration for the webinar later today. If you have a minute, click on it, copy the link and register and join if possible. We'll be happy to see you again.
Okay.
All right. Thank you all.
Thank you.
Thank you for attending today. Have a good week.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye, everybody.
You take care.